My name is Dr. Ibrahim Abd Elrahman. I'm a consultant gynecologist at King's College Hospital. We're pleased to introduce a new service being provided here at King's College Hospital today, which is the procedure known as outpatient hysteroscopy. The aim of the outpatient hysteroscopy is to assess the endometrial cavity. If there's a small polyp or any other minor abnormality that's detected that can be treated in the same procedure, that is also carried out. Now, when hysteroscopy was first introduced as a routine testing procedure, it was introduced to be carried out as a day case procedure under general anesthetic. Once that was carried out, the cavity was assessed fully using fluid to just wash away any debris that's inside the endometrial cavity, so we can take samples from the lining or remove a polyp or something like that. Outpatient hysteroscopy was introduced in the NHS in the early to mid-90s, where it used a very large flexible hysteroscope that you could insert into the endometrial cavity and assess the lining that way. It worked very successfully, but the problem with that is you were reusing the same hysteroscope, obviously after sterilization, but there was also an inherent risk of infection with this procedure. We're lucky now in that we have a new device that's available that we can use, which is called EndoC. This is a two-part device. It's initially essentially a screen and the hysteroscope. The screen is the only part that's reusable. The hysteroscope is used, and once it is used for one patient, it is thrown away. We use a new hysteroscope for the next patient. Idea behind outpatient hysteroscopy is to carry out minor treatment. So what options are these? One would be, for instance, to assess bleeding after the menopause, which is always unexpected and therefore must be checked. To check for abnormal uterine bleeding in somebody who's premenopausal or before the menopause, somebody who might have bleeding between the periods, someone who might have an intrauterine device inside the uterus, but the threads cannot be seen on normal examination to remove it. You may need to do a hysteroscopy to remove that. It can also be used to assess for possible causes of infertility, such as there's any evidence of blockage or a polyp maybe covering the tube or something like this. All these are options. The idea of coming for an outpatient hysteroscopy procedure is we try as much as possible make it a one-stop clinic. So the patient comes in, if they haven't had a recent ultrasound, an ultrasound is done to assess the uterine cavity. If the uterine or endometrial cavity shows evidence of possible polyp or thickening of the lining, and we feel that they need to have a hysteroscopy, then that can be carried out at the same visit. The hysteroscopy procedure can be carried out using no analgesia, or maybe just a little bit of spray analgesia, or possibly what is known as a paracervical block, where we put little injections of local anesthetic on the sides of the cervix. We dilate the cervix very slightly and then put the hysteroscope in, carry out the hysteroscopy, and see whether or not there are any abnormalities, and then take appropriate samples from the lining. What are the risks with outpatient hysteroscopy? Now, like with normal hysteroscopy, the biggest risks are infection and bleeding. The next risk is possibly doing what is called uterine perforation, where when we put the hysteroscope or when we're dilating, the tip of the hysteroscope goes in and makes a hole in the uterus. If that happens, it's not a big concern. We just stop the procedure and the hole heals up on its own. But we know that from all the clinical data, outpatient hysteroscopy has a much lower risk of perforating the uterus than having it done while you're under general anesthetic. So this is another bonus for outpatient hysteroscopy. The other bonus is obviously you're not taking a general anesthetic, which is inherent with all the inherent risks of taking a general anesthetic. Once you've had an outpatient hysteroscopy, you can go maybe after about 10 or 15 minutes following the procedure. The procedure itself will only take about 10 or 15 minutes. So theoretically, in 1 hour from arrival, you go home and that's it, it's finished. With an inpatient or day case hysteroscopy, you're in the hospital for probably half a day, at least 4 hours from admission to discharge. You're going to be groggy with the anesthetic maybe the rest of the day and possibly the following day. So depending on the kind of work you do, it may be recommended that you don't do any work the following day if you need to do excessive concentration during your work.